Very good morning. I'm Kailash Nagar, working as a studio community nursing department at DPCN. Today, I'm going to discuss about the Ayushman Bharat scheme, that is PMJ. Future of the Ayushman Bharat and PMJ. Better health, a universal demand. Ayushman Bharat fulfill the demands. This was the broad vision of our Prime Minister Narendra Modi to start the PMJ Yojana. The slogan was given for the Ayushman Bharat Yojana, that is बीमार ना रहेगा अब लाचार, बीमारी का होगा मुफ्त उपचार. Core features of the Ayushman Bharat and PMJ scheme. Under this one, first, a cover of Indian rupees 5 lakh per family per year, and over 10 crore people and vulnerable families are eligible under the Ayushman Bharat scheme. State given flexibility to decide on mode of implementation, means every state has the right and flexibility, they can decide and how to implement the Ayushman Bharat scheme their own way. Also they can go further. Benefits will be portable across the country, means any person they are residing in any state, they can get benefit in any other state also. Not only they in particular state, they can get benefit across the India. And entitlement based on the scheme. Process of availing care under the PMJ. Suppose whenever a patient is suffering from any kind of the problems and they are registered under the PMJ, how they can get the benefit of the PMJ scheme. First, the patient has to visit the any hospital, those who are suffering or are registered under the PMJ Yojana. So patient has to visit the hospital and they have to stay at hospital or they have to be hospitalization. Then beneficiary identify and registration. Then they have to contact to the counter especially designed for the PMJ Yojana, and they will check their beneficiary and identification and process of the patient. Then pre-authorization request and approval. After the confirmation of the beneficiary, they put the request for the treatment, and based on the treatment's modalities, they request assign, and based on that they forward the request for the approval. Then patient get treatment. Then during the discharge, patient get discharge and they can claim and settlement. No need to pay anything during the treatment in the hospital. It completely based on the cashless treatment. These are again one more diagram flowchart of the how can get patient benefit of this Ayushman Bharat Yojana and how they can identify and how they can register under this scheme, like beneficiary, then hospital desk, identify and verification of the patient whether they comes under the Ayushman Bharat scheme or not. It will be based on the verified by the Aadhaar card. The Aadhaar card will already linkage with the beneficiary accounts, and the individual will be verified. Then check the patient eligibility for the PMJ scheme. Based on the eligibility, based on the disease condition, they get then benefit and they will receive the e-card of the PMJ, and they further they move forward, they can get benefit of the Ayushman Bharat Yojana. Let's see about the details or the core feature of the Ayushman Bharat or PMJ scheme. Annual benefit covers of Indian rupees 5 lakh per family, and secondary tertiary treatment or cashless paperless basis in any or not any but most of the hospital in the India. No limit on family size. There is not a limit in the family size, means like 5 members, 10 members, 7 members also they all comes. If they are covering this scheme, they will be benefit, they can get benefit of this scheme. Release of grant in aid through scores account, they have some escrow account also, and this scheme is aligned with all the state health insurance schemes. So across any state or anywhere in India, they can get benefit. And these are the further classifications of the families, those who are comes under the Ayushman Bharat and those who can get benefit. It will be based on the data or census data, that is 2011. Like rural area, family in the deprivations criteria, there is some criteria they all decided, like D1, D2, D3, similar D7. Automatically included families. So under the rural area, total families under the criteria like D1 to D7, 8 crore families. Automatically included families 16 lakh. Urban areas, that is 2.33 crore families, and RSBY left out families, that is 22 lakh, and remaining other families. Total there are around 50. Yes, there are total 10 crore families. So under the Ayushman Bharat scheme, there are total 10 crore families are getting benefits. These are the target group for the rural areas, like D1 categories, only one room with kitchen, kacha, only one room with kacha wall and kacha roof. D2 category, no adult member between age 16 to 59, means all are the old age people, no in the adult and earning member. D3 category, female headed household with no adult male between 16 to 59 age group. Then disabled members are no able to bodies adult member, and under the D5 ST and SC householders, and D7 category there is this landless householder and driving major part of the, they are comes under this category, or labor workers. Automatically included category in rural areas, that is the household without shelter, destitute living on alms, manual scavenger families, the waste pickers, this is also known as scavenger, primitive tribute groups, and legally wanted laborers. Urban area, so under the urban areas who are the comes under the Ayushman Bharat, who can get benefit, like rag pickers, beggars, domestic workers, street vendors, and hawkers and other peoples like plumber, mason, labor, painter, welder, security guard, all the things, coolies, sweepers, sanitary workers, mali, home-based workers, artists, handicraft workers, transport workers, drivers, and shop workers, assistant peons, electrician, mechanical assembly and repair workers, and washermen, chowkidar, all are included under the Ayushman Bharat for urban area. And those who are left over, for that also Government of India has collected data, that is additional data collection drive they started in 2018, and remaining the peoples, they have collected data from the people. Those are left over the scheme, those are not getting benefit. Ayushman Bharat PMJ ecosystem, how it works under the ecosystem, this is the technological, how the technological work in this area, like implementation already we have decided, like implementation of the hospital, verification of the beneficiaries, then transaction at the hospital, enabling the portability of the service, grievance redress, and fraud prevention. These all are technical departments. And state-wise activities, like already we have discussed regarding this, how they are getting benefit, all the things. These are state-wise activities under the Ayushman Bharat scheme. And deployment approaches for the IT modules. This is regarding for the IT in hospital, how they can set up all the things and how they can verify that beneficiary under the Ayushman Bharat scheme. This is the beneficiary identity scheme system, and this is the home page of this Ayushman Bharat at the hospital level to identify the. And if anyone have any complaint or any beneficiary, so this is all the information for the beneficiary. They can get further information or help if they have any problems. Thank you.